Hello everyone. Our project is on Legg calf Perthes disease by Danielle and Chris.
We didn't have a clue what was wrong with her.
I had no clue. I was just like, this hurts a lot.
She wasn't walking right or running right.
I was 4 years old and I started limping around the pool a lot.
And what was happening, it was slipping out of the socket. Her hip was. All the pain that she had to be going through. I mean, this was not an easy thing.
My name is Carly Jones. I have Legg calf Perthes disease.
My name is Arlene Cruz, and I am Carlene Jones's grandmother.
Legg calf Perthes disease is basically where the joint in your hip dies and the blood flow stops going to it, and your leg is basically useless. I was in a body cast for 2 years.
They put her in the body cast, and she was like that for close to a year. And Dr. Bertram took her out of that. They put some pins and plates in there to keep the hip in the socket. And then they put her back in the body cast for another 6-8 months. And then she was on crutches.
I am walking now. I'm cheering now. It's pretty exciting.
The Children's Hospital of Georgia was so sweet and good to her.
I would like to say thank you because now I'm walking. I can do basically everything that I was never supposed to be able to do.
Oh, I'm so proud of her. She's doing so great. I mean, you know, she's just grew up perfect.
Definition and overview. Commonly, this disease is just known as Perthes disease, and it's a condition where there is no longer blood supply to the head of the femur, which causes the head of the femur to die. This occurs primarily in children ages 4 to 10. There have been some cases of, children younger, ages 2 and all the way up until 12, 15, but primarily it's just going to be within that 4 to 10 age range. This disease affects boys 4 times more often than it does girls. And if you look at the image here on the right, you can see that the left hip is a normal functioning hip, and their right hip is going to be the one with Perthes, and you can see how different that is when you compare the two.
Causes and risk factors. The cause is ischemic blood flow causing necrosis of the femoral head, allowing it to weaken and fracture easier. The true cause is deemed idiopathic, but the ischemic blood flow causing necrosis of the femoral head is the most widely accepted belief. In the bottom left-hand corner, you can see the cartilage necrosis and cessation of endochondral ossification and the bone and marrow necrosis due to the disruption of blood supply. It then moves on to become revascularized, and ossification of the cartilage in the periphery and reabsorption of necrotic bone occurs. It then ends with reossification of the reabsorbed areas. In the top right-hand corner, you can see the arteries that are involved in this disease. Risk factors include age, which is typically children between ages 4 and 10, sex, which is more commonly in males, race, which is Caucasian children, and genetics, which is seen in a few individuals.
Some signs and symptoms of Perthes disease are limping, and they are present with the Trendelenburg gait, which we learned about before. They are going to have pain in the hip, groin, thigh, and knee, and they are going to have stiffness in the hip, groin, and knee. Limited range of motion in their hip joint, and they are going to have pain during activity, but that pain is going to be relieved with rest. And typically this only happens in one hip, but it can happen in both, but it is rare. Primarily it's just one hip that is affected. Treatment is pretty much going to be broken up to the age of the child. With children less than 5, they usually need less treatment. They're going to have to modify their activity, and they're going to have to avoid impact activities such as jumping, running, and some physical therapy that they're going to look at. They're going to want to increase their hip range of motion. They're going to want to strengthen the muscles. Some medications that they could be prescribed are non-steroidal anti-inflammatory drugs, and any kind of anti-inflammatory drug really, to relieve that the swelling in the hip joint. For children 6 and up, it's going to be more aggressive treatment. They could be looking at getting braced or casted, and ages 7 and up, surgery is probably going to be recommended. And there are various different ways that they are going to be able to do the operation depending on the damage of that hip joint. They could do work on the head of the femur or on the acetabulum of the pelvis, or both, depending on how severe the injury is with Perthes. Some physical therapy for the older kids are going to be increasing that hip range of motion, muscle strengthening, and play therapy. Play therapy could be for both age groups. Here are some examples of different braces that people or children could get. As you can see, a lot of them are similar, but they all have their own names. But this would be post-surgery as well as a preventative measure without surgery.
Diagnosis can be done through physical examination, which is looking at range of motion and leg length discrepancies, by staging and classifications, which is Waldenstrom staging, Salter-Thomas classification, hearing lateral pillar classification, Catterall classification, or Saddleberg classification. It can also be done through imaging such as X-rays, radiographs, and MRI. The radiographs are looking at Sharp's angle, which is on the picture on the right. Waldenstrom staging assesses the appearance of the femoral head, which can be seen in the 4 stages pictured below. The first is initial stage, second is fragmentation, the third is reossification, and the fourth is healed. Salter-Thomas classification assesses the size of the subchondral fracture. You can see pictured below the anterior posterior side versus the lateral views. Hearing lateral pillar classification assesses the amount of fragmentation that is on the femoral head. The lower left-hand picture shows a normal femoral head compared to the 3 different classifications, group A, B, and C, of the different varying breakdowns within this classification. The picture on the right is a more in-depth description of those 3 classifications. Catterall classification assesses what part of the epiphysis is involved, which is pictured in the 4 stages below. Saddleberg classification assesses the shape of the femoral head and acetabulum. You can see in the picture below stage 1, 2, 3, 4, and 5. Prognosis: it's a good outcome depending on the stage and classification your child is diagnosed with. As these children reach adulthood, they most likely will have further hip pain, which sets them up for an earlier onset of arthritis.